Both regorafenib and TAS-102 have been shown in clinical studies to extend survival. They have also been recommended by international guidelines, so each is potentially a good option depending on the individual. I realise what I've explained is quite technical. You don't need to remember it, it's just important you realise there are options. The decision we need to make together is which treatment would be best for you, based on treatments you've had before, your current health, and what your treatment goals are. Does that make sense?
I don't know. There's a lot to take in.
I understand, and I can work with you on that. We'll give you some written information to take away. There's little to differentiate the treatments in terms of how well they work, so we have to look at the overall picture, and that includes survival, how we manage your symptoms, deal with potential side effects, and generally maintain your quality of life as best as possible.
Okay. Could you explain again what you think would be best for me? I don't want the treatment that becomes a burden. I've had enough of coming into hospital, and I would want to have my treatment at home.
Okay, I can advise on that. But ultimately, the choice of therapy, if any, is your decision. You are a good candidate for regorafenib because of the previous treatments you've been on. Also, you have responded quite well to treatment so far and seem reasonably well. Regorafenib is an oral tablet that is taken once a day, so you wouldn't have the burden of coming to hospital for treatment, and it's straightforward to manage. So you'd hopefully get the outcomes you want to enable you to make your daughter's graduation. To make the decision, I suggest we reflect again on what you want to achieve with the treatment while maintaining a reasonable quality of life.
Okay. Would it give me more time than the other treatment options?
It isn't really that simple, unfortunately. We can try one treatment and then use the other afterwards if need be. These third-line treatments have shown an overall survival benefit in clinical trials. Some patients experienced a survival benefit of some months. But it is not possible to compare how a specific patient will respond to a particular treatment.
At this stage of the disease, you should avoid to raise unmet expectations from the patient side. So being realistic, what is the treatment aim? In the third-line setting, it's most likely stabilization of the disease, insurance of quality of life, improving prognosis, and not cure or shrinkage of the tumor. By explaining this to your patient, use simple words and avoid too technically complex phrases.
Both regorafenib and TAS-102 have been shown in clinical studies to extend survival. In addition, these treatments have been recommended by ESMO and NCCN guidelines, dependent on individual patient circumstances, so each is potentially a good option depending on the particular patient. There's little to differentiate the treatments from the standpoint of how well they work, so we have to look at the overall picture. That includes survival, how we can manage your symptoms, deal with potential side effects, and generally maintain your quality of life as best as possible.
Oh, okay. It's a little confusing, really, to understand what's best.
I can advise on that. I think we need to start you on regorafenib, as your first-line treatment was the chemotherapy FOLFOX and an antibody against EGFR. And your second-line therapy was bevacizumab.
Okay. Would it give me more time than the other treatment options?
It isn't really as simple as that. I mean, ultimately, we can try one treatment and then use the other afterwards if need be.